I'm going to very briefly discuss some of the skin infections caused by fungi. Now, this can be a problem because it can give rise to various symptoms, as well as it can be a cosmetic problem as well, a beauty problem as well. Now, we have seen, every one of us has seen the fungal infections in the skin. Technical term is malassezia furfur, and you can get patches all over the skin. And it can be a contagious problem. It can spread from one person to another. So, for instance, family members can get it from one another. However, it can be treated easily with local applications of antifungals, but once treated, it might be important for you to treat the other members of the family as well if they too have this problem. Otherwise, it can recur. You might have seen the fungal infections in the nails. The nails can get quite brittle and discolored and have discharge and can start smelling. It's also called can be associated with another condition called athlete foot, or it can occur on its own. Then the nail certainly needs treatment. It can be treated with oral antifungals or with local applications of antifungals. But usually when you treat fungal infections in the nail, it can take some time, longer than a fungal infection in the skin. Athlete foot certainly is a very itchy condition. It can affect the cleft between toes, and again it can be treated with antifungals. You might have heard the condition called ringworm. Quite a common place for these two spread is the groin. In ladies, you can also have it under the breasts, and it can be treated again with antifungals. And when you treat it, the itch as well as the cosmetic problem certainly will improve. And it's important to carry on taking medication and applying it for the prescribed period. So that's a brief introduction about fungal infections that can take place in the skin. So the important message is that they all can be treated and cured.